Depression in the elderly, providing a voice for those who cannot adequately speak for themselves, by Cheryl Pruitt. Introduction. Depression in our older generation is under-recognized and not enough emphasis is placed on this area. Before we can make an accurate diagnosis of depression, we need to know and understand what are the signs and symptoms of this disorder. Depression is not a part of the normal aging process, and if not treated, the outcome will be detrimental for this age group. What is depression? Depression is the state of feeling sad all the time. It is common and serious illness that negatively affects how you feel, think, and act. Depression is also treatable. What is depression? Depression, the symptoms occur most of the day, if not all day, and includes the following: decrease in mood and interest in all activities or pleasure. Appetite changes occur which lead to weight loss, insomnia and psychomotor agitation, loss of energy and fatigue, feelings of worthlessness and guilt, difficulty with focus and concentration, preoccupation with health status, and physical limitations. There is also the recurrent thought of death or suicide. There are many types of depression, and some more severe than others. Major depression can cause social impairment that may bring about a withdrawn personality and decreased cognition. Mild, moderate, and severe are the different types of severe depression with psychotic tendencies. Types of depression continued. Bipolar disorder, also known as manic depression. People with this type of illness change back and forth between periods of depression and periods of mania, an extreme high, sometimes with agitation or irritability. Symptoms of mania may include less need for sleep, overconfidence, racing thoughts, reckless behavior, increased energy. Mood changes are often gradual but can be sudden. Causes of depression. As we grow older, we experience life changes which may bring about stressful events and situations. Loneliness and isolation, which would include living alone or in a nursing facility with no apparent family members. Certain health problems can cause depression, such as illnesses that cause a state of disability, which may lead them to thoughts of the fear of death and dying. Certain medications can also cause depression, and family members and healthcare professionals need to check all contraindications for medication side effects. Geriatric Depression Scale. There are many instruments available to measure depression. The Geriatric Depression Scale, GDS, first created by Savage et al., has been tested and used extensively with the older population. The GDS long form is a brief 30-item questionnaire in which participants are asked to respond by answering yes or no in reference to know how they felt over the past week. A short form GDS consisting of 15 questions was developed in 1986. Questions from the long form GDS, which had the highest correlation with depressive symptoms in validation studies, were selected for the short version. Geriatric Depression Scale continued. Of the 15 items, 10 indicated the presence of depression when answered positively, while the rest, questions numbers 1, 5, 7, 11, 13, indicated depression when answered negatively. Scores of 0 to 4 are considered normal. depending on age, education, and complaints. 5 through 8 indicate mild depression. 9 through 11 indicate moderate depression, and 12 through 15 indicate severe depression. Best evidence-based practice. Person-centered. Become familiar with disease process. Each person should know what is happening within their bodies. Include the family and friends that are willing to get involved in the treatment. Allow for time for reminiscence and sharing of self-gratifying stories. Provide opportunities to interact with their other age-related individuals. Best evidence-based practice, therapeutic environment. Become familiar with our audience and get to know their story. Social workers, we should use respect and understanding. Embrace their understanding and clarify the meaning for the relationship with the patient. Provide support throughout the learning process. Encourage involvement within the community and place of residence. If needed, provide resources to make an easy transition. Reducing barriers. The number one barrier that should be reduced to prevent depression is loneliness. Depression occurs when the elderly population feels that no one cares and are left in isolation within their homes or placed by family members in nursing homes and never visit. To reduce this barrier, family members are encouraged to visit and share with their loved one the many things that they have on their minds, such as participating in social groups that allow them to be creative. Barriers continue. The cost of health care is also at a premium, and most families suffer due to poor health care or the lack of seeking health care. This is where our communities can make a difference. Finding funds to help provide assistance for this population would be instrumental in the care of our aging population. Community involvement. Depression is the most common late-life mental disorder to prevent in community-based primary care. About 1 in 10 primary care patients has major depression, with increasing depression prevalence in home health care, which is 10 to 26%. Banerjee and McDonald, 1996, 2004. L and Innuendos, 2004, in nursing homes, 12 to 30%. This chart goes on to state that rates of depression in older adults are higher among women. Prevalence rates are similar between African American and white elderly, and may be higher among less acculturated Hispanics. Depression isn't a characteristic piece of maturing. It can be regularly reversible with pronounced acknowledgement and proper treatment. Be that as it may, and if left untreated, these feelings of sorrow may bring about the beginning of physical, intellectual usefulness, and social debilitation with diminished personal satisfaction. In conclusion, if you or someone you know has symptoms of depression, take action. This ends my presentation. Thank you.
You can take that off.